Hello, and thanks for tuning in today. I'm your host, Tom Foley. Leaders in all organizations, large and small, are faced with the challenging process of developing a comprehensive delivery of care strategy that integrates the different modalities of a digital engagement. On this show, we explore the challenges as well as how care delivery is extended beyond the classic bricks and mortar health institutions to a digital health home. You can learn more about this show by visiting healthcarenowradio.com. And be sure to follow me on LinkedIn, Twitter at FoleyTom, and the hashtag #TheVirtualShift. On my debut episode, my esteemed guest is Dr. Jonathan Woodson, who leads Boston University's Institute for Health Systems Innovation and Policy. He is a Lars Anderson Professor in Management and Professor of the Practice at the Questrom School of Business, and holds joint appointments as Professor of Surgery at the School of Medicine and Professor of Health Law, Policy, and Management at the School of Public Health. From 2010 to 2016, Dr. Woodson served as the Assistant Secretary of Defense for Health Affairs in the Department of Defense, DoD. As the Principal Advisor to the Secretary of State for Health and Health Protection-related issues, Dr. Woodson ensured the effective execution of the DoD's medical mission. Under his leadership, he oversaw the Defense Health Agency, Uniformed Services University of Health Sciences, Armed Forces Radiobiology Research Institute, Defense Center of Excellence for Physiological Health and Traumatic Brain Injury, and the TRICARE Health Plan, responsible for serving 9.5 million beneficiaries. Dr. John Woodson, welcome.
Pleased to be with you today, Tom.
Dr. Woodson, the Questrom School of Business has kicked off a 7-part webinar series entitled Digitally Transforming Post-COVID Healthcare. You kicked off that webinar series and talked about a digital transformation model. Can you tell me a little bit more about that?
Right. So we believe that in order to have healthcare transform and for various sectors within healthcare to transform and be effective and efficient, they're going to have a digital strategy. Back in 2001, the Institute of Medicine, now the National Academy of Medicine, talked about the pillars of an effective healthcare system. And what they talked about was developing a system that was safe, effective, meaning that we were using evidence-based therapy as often as soon as possible, that it was efficient, meaning that it didn't waste human resources, time, or money, that it was patient-centered, and today we need to talk about precise medicine because your genomics are different from my genomics, and how you react to a drug is going to be different from how I would react to a drug, that it needs to be connected, meaning all of the elements of care need to be connected. And in today's age, where we know the social determinants of health determine 60 to 70% of the outcome of care, information from the social realm also need to be integrated. And then lastly, they talked about it being learning, meaning that it was constantly generating and using new knowledge, and it was pervasive and available. That new knowledge was available at the point of care. So in looking at that, we assessed that for healthcare to transform, for health systems to transform, for industries that support health systems to transform, we needed to develop a new dynamic model of digital transformation. And I would remind you that every industry is thinking about how it's going to do business post-COVID using digital technologies. And it's 4 parts. The first is thinking about your models, processes, and policies that need to be developed to support digital transformation. Of course, which digital technologies you're going to invest in, developing a culture of innovation and a workforce that supports use of digital technologies. And then the last is understanding what real strategic capabilities you want to develop as a result of this model. And it's a dynamic model, meaning that you're going to iterate on it. But also, if industry and companies and health systems do this, it will also create their competitive edge.
Very interesting. Where do you see, we've come a long way since the original thinking around the digital strategy. The High Tech Act has been very strategic for this country. I would argue that we wouldn't have been able to respond to COVID without it. So it was the great investment. One, do you agree? And where do you see your vision picking up where high tech might have left off, if you will?
Yeah, no, that's a great question. And where we're going is that we need to be really advancing our understanding of the interconnectedness of these issues of development of technologies and development of systems that leverage these technologies. So your example of the High Tech Act is a great one because, first of all, the High Tech Act leveraged an economic crisis and investment in technology to stimulate the economy, but also it said, let's try and use this to position ourselves to be better prepared for the future by use of digital technologies. And sure enough, COVID comes around and we're in a better place to respond to the COVID pandemic, but not a, how can I say, the most optimal place in terms of digital preparedness. So where I see the digital strategy going is really extending that thinking and saying, okay, post-COVID, we know that the pandemic has exposed certain vulnerabilities in our healthcare system, whether or not it was in logistics, understanding capacity capabilities, or health inequities. As we go forward now, what we need is a national strategy that aligns all of our efforts in developing and enhancing the use of digital technologies to drive the optimal outcome as proposed by the National Academy of Medicine.
So how do you see what role does the government play? Do you see the government playing in the continuation and the rollout of this strategy?
So I think the government has to play an essential role. It's not going to do it by itself because it has to create the environment for great partnerships between industry, between government, between academia, between advocacy groups and the like. But the government is in a crucial place and plays a crucial role in articulating the national strategy because what it does is it aligns all of the efforts. And the way I have you look at this is in the same way back in 1961, President Kennedy, before Congress, talked about we should endeavor by the end of the decade to place a man on the moon and return him safely to Earth. And when he did that, what he did is he galvanized and aligned the efforts of academia, industry, government to achieve that vision. And we got a lot of great technology out of it. But what it did is it took what would have been sort of disparate progress in, let's say, rocket fuel or astrophysics, but aligned it against the purpose, which was to put that man on the moon and return him safely. And it served our country well. Similarly, today, what we need is the same strategy. And I think that's where government plays an important role and where national leadership plays an important role.
And what role do you think that the payers and the provider and even the patient plays in the adoption of this new model?
So again, an excellent question, and they're all stakeholders. I think national leaders and government can set the vision and align the purposes, but we need to understand what the payers bring in terms of data analytics. And remember, today, many payers are morphing into providers. We see all sorts of new business associations. We see Aetna combining with CVS. We see Walmart associating with a provider and providing care and minute clinics. Google and Apple are getting into the health space as many other previously external business entities are now moving into the health space. So as I mentioned before, we have to take the perspective and understand the contributions of patients and advocacy groups into this national digital strategy as we try and connect more effectively with communities and the home as the basis of care.
Yes, and that's very strategic, right? So we want to connect into the home. So, so the patient, the consumer, the health payer's member, whatever label you want to give them, it needs to be an active participant in this, right? We can have the health system deploy something, and it's more, and like high tech comes across more of technology. And now, while it enhanced the delivery of care, the consumer really didn't feel it, if you will, right? They might have had maybe a little bit more access to their health information through a patient portal, but there needs to be some more work there. What should I feel as a consumer? Again, how do I see this investment affecting me? I'm in the home. Part of the challenge that we're still facing is we have this underserved community that, we talk about technology. And so, the underserved doesn't have access to that. And we have a rural community that might not have the connectivity to engage it. Thoughts on that?
Yeah, so there are that's another great question with a lot of components to it. So to your last point, the issue is that this is exactly why we need a national strategy, because when we think about bringing 5G and broadband to underserved communities and rural areas, we need to be thinking about this as a new utility. And of course, in our history of our country, we've embraced many of the supporting infrastructure items as a national necessity. So whether it was the railroads in the 19th century or electricity in the 1920s or the interstate highway system in the 1950s, these all had specific purposes, but represented a combination of a national effort to improve infrastructure, even as individual businesses and industry advance. And that's when it works, basically, when we can advance private industry but serve the national purpose. So 5G and bringing broadband to rural areas is not only good for what we want to do in health, but it's good for education and it's good for jobs in general. But to the broader issue is what we need to do, understand is with a national strategy is how we align all of the efforts to give what you're talking about, the customer, the optimal healthcare system, optimal outcomes, and the optimal experience in care. So think about this, if we had really a digital strategy, we would be thinking differently about how we interact with health systems in terms of a digital front door. And if we had a digital front door, we could triage patients and get them to their services more effectively and not worry so much about our brick and mortar buildings, but it's about the service components and it's about that efficiency. Clearly, if we have a digital strategy, then we can use the home as the first and last line of care and do it more effectively, serve older patients much more effectively. As you know, companies like Amazon are developing medical Alexa for the home, which can answer questions about medication, connect you with your providers, reinforce post-discharge instructions, and provide support to family caregivers, if you will. So it's about aligning all of these efforts to create a better experience, probably at lower cost for the consumer and the payer if done right. Interesting.
If you're just tuning in, you're listening to The Virtual Shift. I'm your host, Tom Foley. I'm talking today with Dr. John Woodson about reimagining the delivery of care. Dr. Woodson, great points on the home, but I'm still concerned, if you will. You're talking about technology, and I'm still looking at that underserved. And I'll use a case point, not even about technology, but just about the affordability of care. Mm-hmm. It's not whether you not have Medicaid or Medicare or a commercial plan. We work with a partner who provides physician services. It's a consumer-based service, $49 a visit, more of the Uber Care model. The point there being is they had a lot of consumers come on, register for the service, but when it came time to pay for that $49, they exited the system and didn't get the care. They did a follow-up study and found that $49 in and of itself was too expensive. So, and that's concerning, right? Healthcare should be for everyone. I know you know that, and I know you agree with that. So how do we, when we talk about transformation, digital adoption, a digital strategy, that means, that's a digital front door. My digital front door to healthcare is my cell phone, hypothetically, right? The health system has a digital front door. You're talking about the access to information, right? Mm-hmm. So both front doors lead to the same information, hypothetically. How do we solve that problem in getting technology in front of and in the hands of the consumer?
So first of all, we have to understand that it is an issue. It represents a gap. Yeah. Second, I would say that should develop technologies that actually reduce the cost. So just as you've indicated, your smartphone is your portal to healthcare. There's no reason why we can't advance that platform, that low-cost platform, as a portal to healthcare, understanding that in most minority communities, the adoption of smartphones is just as high as in majority communities. But the point you're making about, let's say, the cost of that utility, which is broadband or internet connection, then we need to think about novel ways of paying for it. And if we think it's an important part of health, then maybe what we do is we include in the cost of healthcare the cost of that broadband or that Wi-Fi. But particularly if we look at it as a utility, we can actually moderate the cost in the future. And as I said before, there's a 2, 3, or maybe even 4 positive effect of doing that because it supports education and it supports jobs. So there are ways of getting after that. But I want to address the other first question you talked about, which is health disparities. And so on the one hand, if we don't do this right, of course, the disparities will increase for the reasons you've just given. There'll be the haves and the have-nots, basically. But using digital platforms and addressing it in terms of a national strategy actually can reduce inequities because we can do the proper data analytics. We can identify populations at risk. It'll support better population health. And as I mentioned before, we will be able to address sort of the iron triangle of challenges that we find in healthcare in the United States and all over the world. And that is creating greater access, improving quality and outcomes, and creating sustainable systems with effective use of digital platforms. So thereby decrease, I think, the inequities. The last point I'll make refers back to one of my earlier points, which is that social determinants of health are 60 to 70% of outcomes in healthcare. And unless we understand the other factors and create interoperable databases that might relate to nutrition sources that are available, economic issues, housing issues, we won't drive to the outcomes that we need, particularly in underserved or impoverished communities.
Interesting. So the underpinning of this strategy is all about data. In today's market, we have the biggest gap because we have a lot of data silos, one per hospital, one could argue, or one for EHR implementation. And as you know, there's been a challenge on the interoperability front. Not that we can't do interoperability for whatever reasons. There's constraints on the idea of sharing in the lines of HIPAA. But nonetheless, what you're talking about is, and again, I come from New Jersey. I've shared with you before. I can go to New York. I can go to New Jersey. I can go to Philadelphia. 3 different states. Philadelphia is not a state, but nonetheless, it's 3 different geographies, 3 different EHRs. Nobody knows about me as a whole, except for my payer. But the only thing that they know is my bill. So how do we get from the ease and flow of claims data flowing, because that seems to be something that's just a norm these days, to having clinical data flow to an aggregate repository where you, the provider, can enter your digital front door and see me as a whole, and I, as the consumer, can enter that same front door and see me as a whole and use that data accordingly. Thoughts on that?
Another very good question with many layers to the answer. And so The first is we do need to create interoperable data, which means that this is again why we need a national strategy, because we need to develop how we structure data, record data, gain access, privacy issues and the like. But the data needs to be interoperable. The issue really, though, is best explained by how we got here, right? Without a strategy, we promoted high tech, the development and use of electronic health records. But the business model, of course, was information block, if you will. So if I'm an electronic health record company, I wanted to sell you, licensed to the software for the electronic health record. And even if you were the same system and had 6 hospitals, I'd sell you 6 different customized versions, and they weren't interoperable. Going forward in the future, what we need to do is remove those blocks, open APIs, and allow that information flow, and also to allow it to be analyzed against other databases in order to get a true picture of what you need as an individual for care. So this is why the operative word here is strategy, because again, we'll align where we're going and all of the advances that need to be made in sort of the different contributing sort of compartments, whether it's technology or systems design or whatever it might be. And without a strategy, we get what we call Brownian motion, which is a lot of great activity, but we don't get the outcomes that we desire. So the fundamental question we need to ask ourselves is, what if we don't adopt a national strategy? Where will we be in 10 years? What will the cost of healthcare be, and what will be the outcomes? I think what we will see is the system devolve before it gets better. With a strategy, I think we can actually get closer to the optimized system that the National Academy of Medicine promoted 2 decades ago.
Yeah, I think you're spot on, and definitely a thought leader in the space. So, when we talk about, look at this in context of COVID, right? Because, virtual care, telehealth, really came into being. It was a nice to have prior to COVID, but a must have today with COVID, and hopefully we're getting past that stage, but we don't see it going away. What stimulated that adoption was a policy change. And so strategy, yes, fully support it. But what policies do you think that we need to change in order to advance the type of strategy that you're talking about?
So I think there are going to be many policies that we need to change or think about. Remember, healthcare and promoting population health is both complex and complicated. Complex because you need to optimize programs, policies, and procedures to drive to the best outcomes, and complicated because there are a lot of interdependencies, such as culture, social determinants of health, and these kinds of things we've talked about that need to be appreciated in order to design optimal ways of delivering healthcare. But just to give you an example of policy changes, when I was in government, a number of the leaders of agencies that had health policy got together and wrote sort of an opinion piece in which it was entitled Transforming Evidence Generation to Support Health and Healthcare Decisions. And we talked about the issue of establishing information systems that were effective, where we could create more effective research by creating networks that were embedded all the way down to the individual practice, where you could extract data from, let's say, the electronic health record that would tell you how people were responding, let's say, to certain treatments, or what the effects of certain environmental influences might be on outcomes. We talked about addressing privacy concerns and confidentiality and protecting information, about the standard data, the standard data structure, and sort of across the breadth of healthcare, so that we could extract the data. New methods and models to answer research questions, and efficient study design, which could accelerate research that is being done, particularly as you look at the post-marketing or post-implementation of certain drugs and devices that may have certain effects. So that's just one example, basically, of the importance of identifying what updated policies we need to look at to, again, support a national digital strategy to transform healthcare.
Interesting. So all great stuff, got a strategy. Any insights on when this type of dialogue becomes the forefront of conversation and we see some movement towards adoption?
Well, I think it starts now with the kind of conversation that we're having now. We certainly have been promoting it. The time is right because, again, COVID has created this sense of urgency. As you mentioned, many health systems on the fly had to pivot to digital platforms like telehealth, which meant various things to many different health systems, but they had to pivot on the fly to telehealth systems in order to maintain contact with their patients and continue to support care of non-COVID illnesses, if you will. Well, coming out of this, the issue is, okay, how can we optimize those platforms? How, in fact, can we and where should we invest scarce investment dollars? What new strategic partnerships should we be going after? And all of this is about the pursuit of a more optimal healthcare system, but also for individual health systems, it's going to be how they define their competitive edge going forward. So there's a sense of urgency. Some of the policies that have been developed during COVID, such as reimbursement for telehealth, helps to accelerate and provide energy for transformation. And I think what we need to do is seize the moment and sort of go forth, but we've got to go forth with understanding where we want to be in 10 years. And that's where the strategy comes in.
I agree with you. We're going to have to stop it there. Dr. Woodson, I appreciate your vision. I appreciate your leadership. Great conversation. And hopefully you can join us again in the coming months as this starts to unfold. I want to thank my guests for joining today, Dr. Woodson. And of course, I want to thank the show's sponsors, HP, Intel, and AMD Telemedicine. And be sure to check out the program on Healthcare Now Radio. You can connect with me on LinkedIn or Twitter, Foley Tom, and follow the show's hashtag, The Virtual Shift. Thank you and have a great day.